Let's talk about low back pain. Today is day 12 of 60 Days to 60, and today is Thoughtful Thursday, where I talk about topics on medicine. And today I want to talk about low back pain. Now, while there are many sources of low back pain, over my decades-long practice, I've identified the facet joint as to be a major cause of low back pain. So first, I'm going to talk about the symptoms that you may have. Second, I want to talk about what are the things that you do in your life that have led you to have facet joint pain. Because remember, we don't want to just treat the symptoms. We must address the problem. And the third thing I want to talk about is how do we treat this pain? And most importantly, how do we prevent it? So first, let's start with some of the symptoms that you may have. When you're standing in a line, do you find that you tend to want to bend forward? Also, do you find that whether you sit for long periods of time or stand for long periods of time, your pain is the same? And finally, do you find that sometimes when you lie down, it's hard to find a comfortable position because your back hurts, even though you're lying down and you're not putting any load on your body? All of these things taken together may mean that you have facet joint pain. But of course, remember, I'm not your doctor, so make sure you go to your doctor and discuss it with them. So this is an image of your low back. And these right here are your facet joints. When the joint enlarges, you can imagine how it would impinge on this tunnel, making the tunnel tight. And that tightness can cause the nerve to become inflamed. Sometimes facet pain can present as traveling pain down your leg. Like any joint pain, the number one way to treat it is to unload it and let it have time for the inflammation to relax. A conservative approach includes just using physical therapy. The next level would be to add anti-inflammatory medicines with that physical therapy. The anti-inflammatory medicines are designed to address the inflammation in the joint. The third level of intervention would be facet blocks. In this case, we block a nerve that supplies the joint to get rid of your pain. Even if you treat the joint, are you really addressing all of the problem? No. Remember, all of these joints are your back muscles, and sometimes when the joint beneath those muscles are inflamed, it can cause that muscle to spasm. So it's important to address the muscle spasm to make sure that it doesn't continue to cause the joint to jam. And this can be done in the form of physical therapy, although some people like to add trigger point injections to the program. So if you have more questions, why don't you leave them in the comments below and we can get the conversation started, and I'm happy to answer them in a follow-up video.